Hi, my name is Brian Goodman. I'm one of the internal medicine residents at U of L, and the topic of today's discussion is bicytopenia in the setting of chronic alcohol use disorder, balancing the value of conservative measures with advanced diagnostic testing. Our learning objectives are to discuss bicytopenia as both an individual disease entity and the context of systemic disease, specifically alcohol use and or potential underlying malignancy, to advocate for alcohol cessation counseling as an integral aspect of managing thrombocytopenia, and to highlight ALDH-A1 expression in hematopoietic stem cells as being reflective of susceptibility to hematological malignancies in the setting of alcohol use. Our patient presentation is a 78-year-old gentleman with a pertinent medical history of tick bites, COPD, and alcohol use disorder that presented to the ED with a 2-week history of cough and shortness of breath. He also endorsed fevers, chills, a 10-pound weight loss, and copious vomiting. Pertinent physical exam findings in the abdomen was minor guarding, left-sided tenderness, and umbilical tenderness. And as far as the skin, he had multiple tick bites on his back. For his initial labs and imaging, his serologies were positive for EBV, IgM, and CMV, IgG, while being negative for HIV, hepatitis B, and hepatitis C. On his CBC, he had a white count of 2.2 and a platelet count of 73. His BMP was unremarkable. As far as our imaging on the left here, we have an image of his spleen, which was enlarged at 13.7 centimeters, with a normal-sized liver on the right without echogenicity, no masses or evidence of hepatic vein thrombosis. Figure 2 is our peripheral smear demonstrating decreased platelets with no clumping on the left, and then no atypical lymphocytosis or abnormal myeloid or lymphoid cell lines observed, although diffuse sites were observed on the right. On the day of discharge, our patient had a normal platelet count of 266. Our discussion is bicytopenia, although commonly linked to hematological disease and tick-borne illness, can also be associated with alcohol use. In the literature, scientists have noted bicytopenia to most commonly occur with anemia with thrombocytopenia, while the concurrence of leukopenia and thrombocytopenia is less well established. Researchers have identified variable expression of ALDH1A1 in hematopoietic stem cells and mammalian organisms, which makes them more susceptible to hematological malignancies such as leukemia in the setting of chronic alcohol use. Translating these results to the presented patient and to all who consume alcohol and develop bicytopenia, providers are encouraged to engage in alcohol cessation counseling and recognize the potential manifestation of hematologic malignancy. My references are as below, and I appreciate you for your time. Thank you.